Awesome. Good evening, everyone. Just got the green light to get started. Yat shik shibna Melanie Yazzie nisha. Bilagana nishle ma ideshkijni bashes chin. Bilagana dasha chero tlotsni dasha nale. Bahogel de nasha akut az alden nishle. I just introduced myself in my language. I'm a citizen of the Navajo Nation. I just greeted all of you as my relatives and my people. Thank you so much for joining us again for the second installment of Friday Night Forums, spending your Friday nights with us here to learn about COVID-19 and Indian country tonight. So Friday Night Forums are a series of critical conversations on settler colonialism, US imperialism, and decolonization, hosted by the Red Nation in partnership with the Arab Resource and Organizing Center and the Center for Political Education. The COVID-19 pandemic is global, and so our response to it must also be global. Friday Night Forums feature anti-imperialist perspectives and lessons on organizing from around the world, with an eye towards decolonizing Turtle Island. So join us next Friday, May 1st, for the third installment of Friday Night Forums, same time, same place, Zoom webinar, where else are you going to be, where we'll be talking about organizing workers during the pandemic. And so just in case you don't know or you have friends who want to join, we're also live streaming tonight on Facebook. We're live streaming on the Red Nations page, the Arab Resource and Organizing Center's page, as well as the Center for Political Education's page. So you can find us 3 places on Facebook right now. And tonight's webinar will also be recorded and uploaded onto the Red Nations YouTube channel, and you can share it with whomever you need to, who might not have been able to make it tonight. So tonight we're discussing COVID-19 in Indian country. Just 1 week ago, 6 tribes sued the Trump administration over plans to give for-profit Alaska Native corporations over half of the $8 billion coronavirus aid fund relief package earmarked for tribal governments. That same day, the Trump administration leaked confidential information contained in the applications that tribal nations submitted to receive the funding. Just 2 days ago, my nation, the Navajo Nation, joined that lawsuit. President Janene Yazzie, he's the president of the Navajo Nation, stated, "Allocating funds from the Coronavirus Relief Fund to the Alaska Native corporations will severely impact the Navajo Nation's ability to fight COVID-19 and will impact every other tribe as well." The lion's share of media attention about COVID-19 in Indian country has concentrated on the challenges that Native people are facing in the Navajo Nation. It's been very Navajo Nation focused. And this is for a good reason. You know, the Navajo Nation is third behind only New York and New Jersey when it comes to the rate of infection and mortality, a figure exacerbated by the staggering percentage of our relatives who live without electricity and running water. This is between 30 to 40%. These numbers, I suspect, are actually higher if we're considering the large number of Navajo people who live off reservation in border towns and cities like Albuquerque, which is where I live and where I'm talking to you all tonight from. So there are a number of other factors contributing to higher numbers in Native communities beyond the Navajo Nation. So the pandemic exposed what were already staggering disparities that Native people face in healthcare, education, housing, access to food, income, lack of infrastructure, which includes water, roads, electricity, and internet, virtually every socioeconomic index. And this includes, for example, the housing crisis. There's a chronic lack of housing. A large proportion of the unsheltered and houseless population in Albuquerque, where I live, is Native. Many are Navajo or Dene. There's overcrowding in homes where typically 10 to 15 family members live in a home and constitute a household. There's massive food insecurity in Native communities. So just in the US alone, 25% of Native households, and again, this includes often 10 to 15 people per household, are food insecure. And then 15% of available food, particularly in reservation communities, is fresh. The rest is packaged or has a lot of preservatives. In New Mexico, where I live, in urban New Mexico, like Albuquerque, Native people, including a huge proportion of Navajo people, have the worst healthcare of any demographic in the entire country. And again, infrastructure is chronically lacking in reservation communities like the Navajo Nation. And I'm an educator. I forgot to introduce myself in this way. I'm a professor. I'm an assistant professor of Native American Studies and American Studies at the University of New Mexico. I'm also an organizer with the Red Nation. And as an educator, I've seen firsthand the difficulty that Native students have because of lack of infrastructure, particularly internet, with being able to continue on with their classes under the conditions of a pandemic. And so the pandemic has also shown, I think, a real disparity in access to education for Native people. But also, the pandemic has delivered a massive blow to revenue from tribal gaming. Many casinos have rightfully shut down in response to the pandemic to prevent the spread of the virus. It's perhaps a little known fact that Native-owned casinos are the 13th largest employer in the entire United States. They employ approximately 650,000, mostly non-Native workers. And so casino revenues in poorer counties and cities not only offer jobs to non-Native people, most, i.e. Americans, everyday Americans, but they subsidize public goods like education, infrastructure, healthcare, and public safety. And tribal businesses in New Mexico, again, which is where I live, contribute significantly to the state's overall GDP. And so, in an April 1st HuffPost article entitled "The White House Wanted to Give $0 to the Tribes in the $2 trillion stimulus bill," congressional aides told HuffPost that Republican lawmakers and White House officials waited until the last minute to give any funds to tribes in the bill, and did so only because of intense pressure from tribes and Democratic leadership in Congress. This exemplifies the relationship that exists between tribes and the federal government in the United States. It's often characterized by hostility and neglect. And this is even worse given the fact that economic self-determination is one of the strongest indicators historically of the health and extent of sovereignty that tribes are able to practice. The United States and Canada constantly encroach upon Indigenous sovereignty and treat tribes as resource colonies to be mined for the accumulation of wealth elsewhere. And I think that this is made crystal clear by the fact that Alaskan Native corporations, many of which were not run by Native people and are in fact run by oil and gas executives, were encouraged to apply for a federal bailout, at the cost and the expense of actual tribal nations in the lower 48 who are receiving a much smaller proportion of funds. So this being the case, I believe that support for tribal sovereignty needs to be at the center of our efforts to stop the spread of COVID-19. This is even more important given the Trump administration's efforts in late March to remove Mashpee Wampanoag land from federal trust. There's massive wide social media and news stories about how the Trump administration is doing a horrendous job at responding to COVID-19, abandoning everybody, not just Native people, but like all American people, and now refusing to provide funding to tribes who employ a huge sector of America's working population. And Trump's earlier efforts to stop Mashpee Wampanoag from achieving federal recognition, which he has been pursuing for 20 years, had to do with the economic challenge their gaming operations posed to his own bottom line as a businessman. And so the Trump administration's motivation today, and it will continue to be so even as tribes battle it out through the lawsuit regarding the relief funds, is really about the bottom line. It's about business and the way in which tribes pose a certain kind of threat to the federal government, but then also to private interests, whether that has to do with gaming or resource extraction in the United States. And finally, I think that what this speaks to, right, is that the colonial relationship that tribal nations have with the settler nations that illegally occupy our lands, whether that be the United States or Canada, that what this means is that tribes need to pursue international relations and request support from other nations who are not our colonial occupiers. This includes trying to engage in foreign relations with nations like China, yes, Venezuela or Cuba, to coordinate support for our tribal members and also for non-Native people during this pandemic. And given the Trump administration's hostility toward tribal economic self-determination, this makes sense. So, to transition, to talk about these issues tonight, I'm joined by 3 guests. We're incredibly honored to have you all with us tonight and sharing your work with the world. So our first guest who we'll be hearing from is Jerry Daniels, who's the Grand Chief of the Southern Chiefs Organization, which represents 34 Anishinaabe and Dakota communities in southern Manitoba. And Chief Daniels is a proud member of Long Plain First Nation. And so I'll just introduce all of you and then you can speak in turn if that works for folks. And so our second speaker tonight will be Destiny Morris. Destiny is, and I so apologize for possibly mispronouncing this, Nuchalnushkitchkan, in Irish. Destiny is a member of the Red Braid Alliance and has been for 3 years. She lives with her mother and supports her with her physical disabilities. Destiny is also a part of the Indigenous Leadership Council and writes poetry and is a retail worker at Savers. And finally, we'll hear from Janene Yazzie tonight. Janene is the Sustainable Development Coordinator for International Indian Treaty Council. And on behalf of the IITC, she serves as the co-convener of the Indigenous Peoples Major Group for Sustainable Development, which engages with the United Nations High-Level Political Forum on the 2030 Sustainable Development Goals. She is serving as a volunteer with relief efforts and is the New Mexico team lead for the Navajo and Hopi Families COVID Relief Fund. So I'm going to turn it over to you, Chief Daniels, to get started.
Okay. Hello, everyone. Thank you, Melanie, for that introduction, and I want to welcome everyone to the panel. And I know everyone has been very concerned with what we've been seeing around the world with COVID-19. Obviously, it adds a lot of stress and to many of our communities who have already undergone decades of oppression, government policy that has brought us to the margins of the social economic, when you measure it, a social economic situation that we find ourselves in. It's been very challenging for us in our region. I'll just introduce myself. Ogi Mamakwa, Dishnakaz, Gaganus Deag Duanji, Banasi Dudim, Chimikwech, Gijimani Tunungum. I thank the Creator for another beautiful day, and I want to thank everyone who's been involved in organizing these series of discussions. I just want to get back to my role as the Grand Chief of the Southern Chiefs organization. We represent about 90,000 citizens of the Anishinaabe and Dakota Nations, which has been broken into 34. And so that's kind of how it's structured here in southern Manitoba. We've been working very hard to gain control of a lot of the social spending and policy directions in our region. We have a regional office actually that's housed here in Winnipeg. They take direction from headquarters in Ottawa. And there's kind of a back and forth depending on the nature of whatever the issue is. The decisions are either made here in the region or they're made in Ottawa. And that's sort of the structure that we face here. And we could talk, whether we talk about CFS or any issue, healthcare, justice, all infrastructure in our region, it's all really kind of done through that office, regional office. So just to give a bit of context to our situation here in Manitoba. So we have 34 chiefs in our region, and each of our communities have engaged in different ways in flattening the curve, as many have said when it comes to COVID-19. We've had communities who have shut down altogether any in and out of the community. We've had communities who are screening supplies, and so they're bulk buying and screening the supplies that come into the community. There's lots of those are like the short-term actions that have been taken recently. Obviously, everything's been shut down in our communities, so it's just bare essentials right now. It's really just the essential services, as everyone's calling it. That's the current operation that we're seeing. So now we're shifting to planning in the midterm. What are we doing in the midterm, and how? What does that look like? So that's been very. There's been different ideas on how we're going to transition into kind of an era of where COVID-19 is going to exist, and how do we work with the federal government and then the provincial government. The challenge here is that the federal government takes a lot of, they take a huge role in decisions of financial allocations, also policy as it relates to on reserve. So they have a great deal of a role in our communities, which is a very real terrible situation. We've always obviously advocated against that. We've always pushed for direct control, community-driven strategies and solutions, those kinds of things. But I want to move over to just healthcare specifically. We've been working towards what we call health transformation. And what that is that First Nations on reserve take control of their health policy, their health institutions, and the health funding envelopes. So all of the money that's basically flows into on-reserve First Nations health. The leadership here in our region is tasked with structuring and getting these expertise around all of that. I know BC has kind of moved in that direction quite a number of years ago. They have a BC Health Authority. So we're looking at something very similar. And what that is that we take over the control and direction for all of southern Manitoba. And then we also provide service for off reserve. So in BC, there is non-First Nations who actually access the services that First Nations are providing through their health authority, so their First Nations health authority. So we're looking at those kinds of things. We took a trip to Cuba not that long ago, actually just in April. We headed out there, and we had discussions with the minister there of health. We met with the Canadian ambassador to Cuba. We did tours of many of the Cuban facilities, health facilities. We went to the school, which is the largest medical school in the world. We went to their International Cooperations Center, and we were provided with a great amount of information around how they've operated and how they've focused on prevention rather than dealing with the issues after the health situation kind of deteriorates in communities or in regions. And so they highlighted their work that they did in South Africa during the Ebola outbreak. And so we got into a pretty good relationship with them when we met with the minister. We provided some gifts and we left with a sense of a willingness to work together. We had 3 of our chiefs that were there: Chief Batson, Chief Hudson, and Ledoux, and also Chief Kent. 4 of our chiefs, sorry. And all of those chiefs were interested in having doctors from Cuba come into their communities. And right now we're talking about, okay, well, if we're going to get a health envelope and we're going to structure a health system in our communities, how can we maximize those resources? And in Canada and elsewhere around the world, we see instances where, you only have so much health resources. And what we wanted to do is, if we could work with a country who is recognized as a leader around the world, could we get a better return on our investment than what we would get here in Canada? And that's basically what we pose to Canadian officials. That's what we state to the Canadian broader society, is that if we can get a good level of care and we can see a change in the health outcomes in our communities by working with Cuba, then that's a direction that we should take. And maybe all of Canada should start looking at that sort of a process. And we see that around the world in different industries where resources, human expertise, like professional expertise, is brought in to countries to help with engineering, like things like that, buildings. All kinds of projects. So it's not a far ways to go to say, okay, well, maybe we can bring in health professionals from a different country. In First Nations, we have at least here in our region, we have a great deal of difficulty keeping nurses in our communities, in some of our isolated communities. And we wanted to see, okay, well, if we brought in health doctors and health nurses, 1 doctor and nurse per community, we would look at the costs obviously associated with that. Well, what would the impact be for the community? And because we're taking control of the resources, perhaps we would get a better return on our investment. Perhaps the outcomes would be better. So that's why we focused on Cuba, or why we really pushed it and drew a lot of attention as much as we could to that eventual reality. And we had communities who were already engaging with doctors from Cuba to bring them to their communities. So we wanted to broaden that and to have perhaps all of our communities, if not at least half of our communities, have doctors, and perhaps send some of our students to the Cuban medical school and to see what kind of impact that would be. And even if it was 20 or 30 to 50% of our allocation, of our financial allocation, if we could get a better return on that and we see better outcomes in those communities, then I think that's a good thing for us. And that's where we focused on. We didn't get into the global political environment around Cuba and the United States. We really just focused on the issue and trying to create better outcomes for our people. That's our role. That's what the chiefs ask us to do. That's what our people in our communities ask us to do. You know, to take away all of these other things and to help make our communities better. And so that's what we focused on. And we're continuing that work. We sent a letter to the Prime Minister here in Manitoba, or in Canada, Justin Trudeau, and we didn't get a very good response, although they did not say that they wouldn't. So that is still an ongoing discussion for us. In the meantime, we've been focusing on getting an agreement for health transformation. We do have upwards to 3 million, if a little bit more than that, per year right now, just kind of working with our communities. We have staff in every one of our communities. Well, not yet, but we're hiring. We probably have about almost 20 people working in every single community. And what they're doing is they're developing, they're working with the health director, they're working with the current health workers in the community to establish a strategy that would work not only with what's existing in the community, but also what exists off reserve. So we have regional health authorities here. There's about, I guess, maybe 7 of them here in southern Manitoba. And basically what we need to do is we need to work with them to first create better communication. Second, fill the gaps. Where's the gaps in healthcare right now? And how can we change the determinants of health? How can we do prevention? And we think that the Cuban doctors and the Cuban health service could perhaps bring a lot of value to that conversation. So if we are to bring them into the planning of all of this, we think that might actually change the way this is being done. So those are the kind of things that we're considering and we'll likely implement going forward. So that's sort of what we've been doing here as it relates to healthcare just generally. In the face of the COVID-19 pandemic, we've had an urgency to speed that up. So that's why we sent the letter. We've been working with our communities to see who is willing or would like to move quickly to have a Cuban doctor and a nurse in the community, residing in the community. So those are things we're just fleshing out right now. We're just in the middle of all of that. In the meantime, we're likely looking at an agreement with Canada in the next few weeks, hopefully. And then from there, we could start to talk about the medium term. Like, what are we going to do in the medium term on to get to ourselves to an agreement in principle, where we would start to take over and start to expand and build our own health authority here in this region. And I think that if we could focus on international support to enrich and add value to that, I think that's a good thing for us, and that's where we're focused. We want to be able to do as much as we can for our communities. That's our role. So that's what we've been doing over the last several months, and a lot of it depends on what happens on the ground, like what happens in the community. Which communities are ready to move right now? How do they want to move? How that information is communicated? We don't dictate how these things happen. So we're kind of waiting a lot. You know, it really is based on the resources in the community and what they see and how they want to communicate. And if they even want to work with us on developing a health system. Some communities just want to do it completely on their own or within smaller regions where 3 or 4 or 5 communities. So there's also that aspect that plays into all of this. And so we just try to do the best that we can to serve all of our communities and try to create positive outcomes, try to make best use of our resources, put political pressure on the province and the feds to move quicker, work with our international partners. We do all of these different things so that hopefully we can have a better outcome for our people, better quality of life, those kinds of things, a better health system. So that's what we've been doing. We're just waiting now, I guess, to see when. Right now, obviously, everybody's restricted. We're we're just kind of waiting. All of the focus has been on COVID-19. It's funding for students, it's funding for people who are unemployed, like all of that stuff right now, probably for another week is where the focus is going to be. But we're starting to see right now, I just had a conversation actually with the minister today, Mark Miller, our federal minister, and there hasn't been a lot of change or shift towards what's going to happen in the medium term. What are we going to do in terms of what we've been doing, what we were doing in like regularly, like what our plans were with health care, CFS, justice, all of these things that we work on as advocates with our communities and all of the institutions. A lot of that stuff kind of got paused for the last almost 2 months now. So we're just kind of waiting, okay, so when do we get back to that? When do we get back to talking about transitioning the responsibility and the authority over all of these areas to First Nations? Because we really haven't had direct control. Even when they transferred authority to First Nations, we were still managing their programs, and we still do today. And we're managing poverty. That's the challenge with our communities, and we've gotten really stuck in that. Our leadership have been stuck. They're actually our leadership is managing poverty. That's what they're doing, day to day managing poverty. And then there's conflict that happens there at a community level, right? You can't provide everything because you're underfunded, right? You can't provide all of these different things. You can't provide a house to everybody. You can't, like there's all of these different things, and it gets worse and worse. And my fear is that in a situation when the economy is really, really feeling a lot of pressure, and we're seeing it with the global market right now, is that the priority for spending, and we see it right now, there's inequality in spending. When the allocations went out, we received less than 1%. So just over half of 1% of the federal allocation. That's what First Nations receive. And then there's also an off-reserve component there, and that off-reserve component isn't controlled by the First Nations leadership. It actually goes to just organizations that have sprung up in the urban areas. So that doesn't really help with the Indigenous governance, right? And also that's a whole nother conversation, because we always have conversations of, well, what is the legitimacy of the Canadian Indigenous governance? The Indian Act chiefs and all those kinds of things. Like that's a total conversation. My question always is, well, where is our leadership then? Like how do we decide? And if you believe in democracy, then perhaps you can support the way the leadership is structured. Maybe we need to make tweaks. Maybe we need to change it. Do we need to make it bigger at an aggregate level? Like larger. I believe in the Anishinaabe Nation. I'm a big believer in Anishinaabe. I believe that our nation transcends international boundaries. Like we go right into the States, and that's what I've been doing. We went down into Minnesota actually not that long ago, when we met with the Minnesota Ojibwe Chippewa people, and we actually reached out into Michigan to talk to meet with the descendants of the late Chief Pontiac, and we did that because that goes all the way back to the Royal Proclamation, which set the kind of the groundwork for their movement into the West, and the Treaty of Niagara, all that kind of stuff we've done. So I'm a big believer in that, but there's a lot of politics that happens when you have to deal with a lot of different communities and trying to get a lot of different communities to agree. And I'm a very practical leader, I like to think, and I really listen to what leaders have to say, because if I'm going to get people to work together, I have to know where they're at. And so I try to stitch it together. Like, okay, well, these chiefs, these communities can work together. We'll support that, and we'll support this. And sometimes, even in doing that kind of approach, doesn't always work. Some communities they just want to do it their way, and that's fine. And that's how we do it. Keeping in mind that our strength is obviously in our collectivity. We're facing a very strong opposition, in the colonial state. There's a lot of very wealthy, sophisticated people who've worked to create the circumstance that we're in right now. And it's going to take a great deal of coalition building and unity to really push back against that. And hopefully it doesn't take huge like COVID's obviously, my hope is that when we come out of this, that things are better, that people are more unified, that we care for one another more, because these international issues that we face, we're facing them all collectively. It's broken down into regions, but we're facing it as one people. So we are doing our best to take control of the different policy areas, because I don't see how we can get out of that from where I see right now. There's a great dependence on federal transfers, and until we start to create our own resources, or we just turn from it. We turn from resources. We turn from the current society. But I do not see any hint of that happening. It's very, very minuscule. Maybe not even. It's just a very small percentage of us who are living in a traditional way. There's not very many of us. So a lot of us are stuck on this system. So how do we shift that to our own Indigenous system? And I just don't. Maybe not my lifetime, but I like to think that hopefully we help to create these systems to make them better, to make them more responsive, to make them, that there's not as much barriers to our people. Like if you want a health service, you shouldn't be left in the hallway for hours and hours on end. We should try to create a better health system just overall. So that's what we've done. We haven't been too adversarial, but we did shut down the highway 7 times last year. So we were pretty adversarial at the same time. But we also want to be diplomatic. So and we want to do best practices, and so that's what we've done. And I'm not sure much more I can add, except for we're hoping to see our agreement in terms of health transformation happen rather quickly. And we were having, obviously there's a day-to-day call. Our staff are on there every day. We have our staff, our senior management involved there. And we're just hoping to move, to take control, bring in the best people that we possibly can. We have an agreement with the mayors here in the region. It's the first one in Canada, and basically the agreement we signed with the mayors is that we would work collaboratively on economic development, waste management, water management, and we did that because when the flood was happening, when I first became Grand Chief, what I saw was that, okay, well, the reserve would clear the ditches for the water, but then when it would hit the municipality, they wouldn't clear the ditches. So then it would just back up. The water would back up. And I was like, this is just a pure communications problem. We're just not communicating, And if you start to talk to each other and start to develop a bit of respect for one another, maybe you can start to create some, very practical solutions. It doesn't take a whole lot as long as we're conversing. And so that's kind of the attitude I tried to create. And we had several meetings with the mayors and our chiefs over the last 2 or 3 years. We got to an agreement. We signed it almost a year ago now. There's a whole video on it that you could check out on our website where the mayors are talking and the chiefs are talking about what we'd done and how we were working towards building what we called, or what's being called, circular economy. And so that's kind of been our focus here in the region and we were looking, I think it was Norway or one of the Norwegian countries. They've established a circular economy. So it's a zero waste economy. And so that's the kind of stuff we were looking at, just kind of practical solution, hopefully shifting the thinking, shifting towards, well, we can work together. There's no reason, and we should all be able to benefit, and it should be done in a way that's sustainable, and hopefully COVID has given people some time to think about that. To think about how we live our lives and what's really necessary. When you're sitting at home for hours and hours a day, or you're spending a lot of time, you're not out and about. It gives you a lot of time to think about what's important, and family is important. People you love are important, and those are the kinds of things. And so, healthcare, or this health situation, I hope has created some of that. So I think I'm just going to leave it there. If people had questions, I could answer. But I think we'll just pause there now. And thank you again, Melanie, and everyone who helped coordinate this. Chimigwach.
Well, thank you so much, Chief Daniels. A lot of food for thought. We have some questions that came in, but I think we're just going to wait until all of the speakers have finished, and then we'll do like a larger Q&A at the end. There is definitely a request for links to the websites that you're referencing. So we'll also try to get that compiled by the end of the webinar, and we'll certainly put it on the social media around the webinars. So I'm going to hand it over to Destiny.
Hi there. My name is Destiny Morris. I am Nuu-chah-nulth, Gitxsan, and Irish. I am from the Wolf Clan and am my mother's daughter, who is also Nuu-chah-nulth. I am calling from Burnaby in the unceded Coast Salish territories of the Musqueam, Tsleil-Waututh, and Squamish territories. And in my language, to say thank you is kleko kleko. And today I'm raising my hands to the Red Nation for inviting me to speak my presentation here. Kleko kleko to all the work that has been put into this. So I'm part of the Red Braid Alliance. So who we are and what we do. Who we are is a group that is building a unity between Indigenous people, the working class, and homeless people. The Red Braid Alliance is a grassroots organization built on 3 points of resistance: anti-colonial, anti-imperial, and anti-capital. Our steps in this world are to tie or to braid these 3 fights together. We do this by fighting the never-ending colonial power of the state. The Alliance looks to communities that are being attacked by these powers, and we come together to strategize and politicize our experiences. We meet as campaigns and look at what is the threat and how to fight back. In Metrotown, it is condos crushing 3-story low-income buildings. In Maple Ridge, it is homeless people that fight for homes, not jails. As a collective, we talk and meet about what is happening and how it affects us. When we are all on the same page, we figure out what we want to see in our neighborhoods and communities. There are Indigenous people in all of our campaigns. Not to look at these as individual incidents, it is a result of the state abusing its power on vulnerable and people that are at risk. Singling out individuals, convincing them that it is their fault. We make meetings to hear each other. When we hear each other, we understand better that it is a collective experience, that we can stand together in numbers. When we stand together, we take action that supports people's needs of survival against colonialism and forward revolutionary solutions. The work of oppression to communities is not just done by the government or RCMP. It is done by Canadian citizens, Canadians who benefit from the system, Canadians who benefit from the system that steps on the throats of Indigenous people and people who live on the streets. Their defense is to blame the individual for not making better choices, or that they should just get a job. Canadian citizens do this work for the state. It is not just verbal attacks. They also physically attack people on the street with violence because they see something they are afraid of becoming: homeless. When we come together, we have power, we have safety, and we have each other. We have a fight for all of us to have housing and Indigenous people to have sovereignty. To quote Mama Bear from the Indigenous Woman Warrior Statement, when we started a squat in Surrey, a suburb of Vancouver, to create a safe space for people to self-isolate from COVID-19. This space was made for underhoused communities or unhoused people. Mama Bear is an Indigenous woman warrior. She is 45 and has lived on the streets for most of her life. She is part of the a part of the Indigenous woman warrior who or that we brought together to build the statement for the Indigenous wing in the hothouse squat. To survive COVID-19, we have to keep on protecting Indigenous spaces. We have to protect our physical spaces where we can see and care for each other. We have to defend all our relations against being controlled by building managers, surveilled by police, and killed by colonizer violence. To me, this speaks on multiple levels of survival. We save each other and ourselves by being in our communities. What I have heard is that Indigenous law says that life is sacred. This has been taught throughout my life by my mother and in Indigenous spaces around me. It is a law that must be practiced to survive this crisis and many others that we face. The state, Canadians, and COVID-19. With the economy crashing before us, vigilantes are getting more consistent and more violent against homeless people and Indigenous people. In Nanaimo, I heard this person named Shane explain the situation for people. He said over the last 2 months, 2 of his friends on the street have been hospitalized by vigilantes. One was jumped and beaten with a bat by a man who profiled him as homeless because he was Indigenous and walking into a residential neighborhood with a backpack. The other was jumped by 3 guys with knives. He was Native and pushing a shopping cart. Vigilante violence is anti-homeless and anti-Indigenous. It is clear to people how easy it is to fall through the cracks and go from a home to the street. The province has a moratorium on evictions for if you can't pay rent due to COVID-19. But as soon as this moratorium is lifted, everyone is expected to pay the back pay rent that is owed during the crisis. This is what can bring people to homelessness. Not being able to pay rent is no one's fault. And it should not be treated like it is. This is why we do the revolutionary work we do. We see the threats that many communities face and we take action alongside. We choose to carve out space for the leadership in these communities so it can grow and strengthen their political power. My personal experience with learning and seeing these actions happen made it clearer on how everything is built on violence. Actions like building a tent city or doing a squat at a building has taught me many things. The government does not view a homeless person as a person, but we do. Once a homeless person joins a collective, the public and the state are forced into an uncomfortable position of having of acknowledging them as a human. Once this person is a human, that means responsibility. This is not what the government wants, because by taking responsibility is saying that this is their fault, that the system is flawed. A system that is built on the deaths of Indigenous lives and the theft of land. Seeing how homeless people are treated by the police and Canadian citizens are violent and are life-threatening. People that have been brutally attacked solely because they represent the future that could be anyone's. Everyone is either 1 or 2 paychecks away from homelessness. Another life-threatening hazard is that ODs are rising, higher than ever. The last week of March, the overdose deaths have been at the highest they have ever been since 2013. Doing CPR is no longer allowed. And without a home, it is life of crisis on top of crisis on top of crisis. With COVID-19 a new threat on the block, there is absolutely no resources to go to. Soup kitchens are closed with nowhere else offering food. Food banks are no longer distributing food to low-income families. There are absolutely no other alternative for these resources. Shelters do not have the space to comply with social distancing or any medical protocol. Or medical protocol if somebody thinks they have caught this virus. If somebody believes that they have COVID-19, they are told to go to the hospital, but there is no follow-up by these shelters to make sure that they receive the medical needs that they need to receive. They do not think of those that were in proximity of this person who could be affected. This negligence is dangerous to communities and threatens lives all around. The government could use the state of emergency to open hotels to those who need to self-isolate and be safe. In Vancouver, there are 12,000 hotels and 90% of them are empty. These buildings could be used for the underhoused and unhoused communities to safely isolate. This is not being done, and this is what we are demanding as Red Braid Alliance. We have a campaign called Squat to Survive, and it started when we knew the needs of communities. We do the work that the government should be doing with the Squat to Survive campaign. On April 1st, we had taken an unused rec center. This was to protect our lives. On April 18th, we took a vacant, unused school building. We were arguing that people's lives were on the line, that cops did not have the right to tear this sanctuary down. The police tore it down anyways, using riot gear. Unhoused or underhoused are similar and are in survival mode. Those that are underhoused live under anxiety from gender violence within the building. Fleeing to a building to safely self-isolate takes weight off shoulders. carving out space, carving out this space for us to be together and safe provided relief to my anxiety. Homes that are not safe for Indigenous women puts these women in danger. Hearing where unhoused people slept the night before also fueled fire in my heart that this squat needs to happen. This fight for Indigenous women fleeing gendered violence. This fight is for migrants being chased out of hospitals and are being forced to sleep in the harsh environment being snowed on. This fight is for everyone who is in need of safety that the government refuses to provide. We are shut out and we are left out to die. But we, as an alliance, will fight back like our lives depend on it, because it does. And we have also made 5 demands for COVID-19 for our basic human needs to be met. That concludes my part of the presentation. Thank you.
Thank you. Yeah, Destiny, that was incredibly powerful. Just listening to your words and hearing about the reality on the ground for unsheltered relatives, Native migrant women, LGBTQ2 or otherwise. I know that there is very little research or understanding of what's being done right now to support that community. So I really appreciate the work that you and Red Braid are doing. We have some specific questions for you, but again, I'll just save that till the end so the 3 of you can have a conversation around the questions. Thank you so much. So I'm going to move us to Janene, and then we'll move into Q&A.
Miigwech to our northern relatives for joining us today and sharing such powerful presentations. Janene Yazzie and Nanjinin Shlando Todachitni Bashishchin Nitlanadashichay Zilkai. I'm coming to you all from Gallup, New Mexico, and I have a slideshow. Is Nick still sharing it? Is it going to share it? Or do I share it? All right, awesome. He started with my rugged slide. Okay. I'm Janene Yazzie, and as was said in my introduction, I'm a Sustainable Development Coordinator for International Indian Treaty Council, but I've also been working as a volunteer for on-the-ground relief efforts here in the Southwest around the Navajo Nation and serving the Navajo Nation and Hopi Nation. And so you can go to the next slide, Nick. So a lot of people know already that many of our communities are dealing with a lack of critical infrastructure that has created particular vulnerabilities to this crisis. One of those vulnerabilities is around food scarcity, and there's been a lot of work done around transforming the narrative around the framing of food deserts, because what we're really dealing with when you look at the context of colonization and how that's gone hand in hand with the destruction of food systems and the assimilation of all of our landholders into a particular type of capitalist dependency and living, what we're really talking about is a food apartheid. And so as a result, the Navajo Nation is the size of Massachusetts, New Hampshire, and Vermont combined, but in that area, we only have access to 13 grocery stores. And recently, one of the grocery stores in Pinon, Arizona, that because there was an outbreak and a confirmed case with one of the workers, that grocery store closed down. And so it shows just how serious we have to take these issues and create preventative measures, because there's already still little access to the resources and the supplies that are needed in order to support social distancing, self-quarantine, and isolation practices that prove to help stem the curve. Can you go to the next slide, Nick? And so not only are we talking about the lack of grocery stores and how that exacerbates our ability to prepare for and to practice the social distancing requirements, but we also have a critical lack of healthcare infrastructure. As was spoken about by Chief Daniels, this is endemic across all of our nations and all of our communities. And the Navajo Nation being one of the largest contingent land-based tribes in the U.S. This is easily seen through this map. I created these little blue stars to show kind of where the Indian health services are, and the boundaries in the different colors show what their service areas are. And so even though this is just showing Indian health service areas, we also have 638 facilities, and we have some private healthcare centers. These are most often the healthcare centers that are used by the largest amount of people on our reservations. And so getting access to these healthcare facilities for just regular care already exacerbated a lot of the public health issues and access to all forms of treatment and preventative care that we were already seeing and experiencing prior to COVID. But now with COVID in this Cayente area, the top, I can't use my cursor, but in the Cayente area, the service area, what we saw is that with the breakout in Chichen Bateau and the transfer of the patients to Tuba City Healthcare Center, prior to us having access to a lot of the testing that we needed in order to confirm the tests, required then those patients to be transferred even further all the way to Phoenix in order to get tested. And so at the beginning, when the first cases started to come in, you already see this enormous spread and this explosion of cases because of the pathway of exposure that was necessary, simply because our healthcare systems not only are very sparse, but they're already understaffed, they're already under-resourced, but they were particularly unprepared because of all of the federal bureaucracy and red tape to actually address this virus and this contagion, the spread of it head on. You can go to the next slide, Nick. So this is my rugged map, like my fabulous graphic design skills showing their hand right here. But I really wanted to talk more about a lot of the root issues and the systemic issues and the situation that was already present prior to the virus coming, that have contributed over time to us dealing with all of the public health crisis that we see, and all of the prevalent cardiovascular disease, liver disease, cancers, asthma, all of these things that make our population particularly vulnerable to contracting moderate to severe forms of the virus. And so the base map is showing the location of identified or prioritized abandoned uranium mines with high gamma radiation. This is only the 500 identified mines that qualified for cleanup through the Superfund that was created, and through which no progress has been made to actually clean up these mines. But the reality is that there are thousands of these abandoned sites across our lands. But I wanted to show this in particular because the red circle at the bottom of the map shows an area that I grew up from that was heavily impacted by the 1979 Church Rock uranium mill tilling spill, but does not qualify as being part of the Superfund sites because it's nowhere near within a 20-mile proximity of an actual uranium mill tilling site. And prior to COVID, I partnered with Dr. Tommy Rock to carry out a uranium water quality testing project with the organization that I co-founded at the time called Little Colorado River Watershed Chapters Association. And we showed and proved the contamination throughout that whole region. And so this was part of our larger climate change and water security and food security work, because we wanted to show that we can't just focus on food security and water security to build a foundation for resilient communities without addressing the legacy of resource colonization and environmental contamination and all of the systemic injustices that come from living in lands that are designated sacrifice zones and that have served as resource colonies to support like cities like to Phoenix, Tucson, Los Angeles, Las Vegas. And that it's important for us to hold this image as a whole. Unfortunately, I couldn't find someone to do it professionally, so you got my doodles. So that shows that that whole area was contaminated. The blue lines show the movement of waters through our nation, and that just shows at the bottom, that's the Rio Perco. So the water and the movement of the contaminated sediment goes west, where it meets with the Little Colorado River, which flows north into the main stem Colorado. And so you can see the water flows through all of these areas that have this contamination present. So not only are we dealing with lack of water security and the terms of like actual infrastructure to get access to drinking water to homes, but the water that is there is also contaminated because of the ongoing legacy of uranium mining and the abandonment of uranium mines, and just the lack of solution to actually extract these harmful contaminants from our soils and from our waters. Over to the north, you see the same flow. That is the San Juan River, which meets with the Colorado River. And so you see the same dynamic sort of taking place. And with our climate change work, addressing and holding all of these things, one of the things we're investigating, and Dr. Margaret Heiser Redsteer is a paramount researcher in exposing all of this. But on the western part of the Navajo Nation, we see a spread of sand dunes, which they prove it leads through the wind. The sands from this area through the wind get carried all the way up north into the Colorado Rockies, which has created this feedback loop that leads to quicker and snow melt, to like all of these, exacerbating the whole cycle with the hydrologic cycle, all of the impacts of climate change. But that also shows the movement of these contaminated soils across our lands through the wind. And so the black squiggly things are supposed to be my coal stacks, because we're surrounded by those coal mines. A little further south from the red circle is also the Cholla coal plant. And these all have impacted our air quality for generations. And so we see, especially around these areas where the wind flows and where this contaminated air sort of sets into pockets and valleys, is where we were seeing a rise in childhood asthmas and an adult asthma, which is another precondition that can lead to you developing moderate to severe forms of the COVID virus when you're exposed. And so far to the upper right, where all the orange squiggly lines are, I love me. That's the only area that's not surrounded by uranium contamination, but that's where all the fracking is happening, all the hydraulic fracking. And so you see, when you hold this picture, this is the cumulative impacts of exposure that led to the public health crisis that we've already seen. And you can go to the next slide, Nick. And so that's why we're having such a blow up and explosion of the severity of these cases. This is information from the Navajo Epidemiology Center from today, which shows that there's 1,360 confirmed cases out of 6,000 tests that were performed. The total confirmed deaths is around 58, but 52, but this information has a 48-hour lag. And so this is not up to date by the hour, because they have to take time to actually verify this information. But we know from an investigation that was done by Navajo Times, as well as anecdotal data that we're hearing from the ground, that this may not fully capture how many deaths and how many positive cases that are out there, because test sites are still hard to get to. Like, testing is still not widely available. But also we heard so much data, and Navajo Times has confirmed this in their reporting or in investigative journalism, that people are dying in their home before they even access healthcare, before they even get tested. And this is because, due to the pre-existing conditions, a person who can be an asymptomatic carrier of COVID can go from having no symptoms to being a severe case in a matter of hours. And when we're talking about people needing to take hours to actually access the healthcare system, not having adequate information about how to distinguish their symptoms from other forms of, like, the mild cough, a mild cold, or other healthcare issues, and people being fearful about actually going to the hospital because they might risk exposure just in that process and bring that exposure back home. Like, all of these are leading to people seeking healthcare far too late. And we still don't have a real idea of how many deaths are as a result of the COVID virus. We can go to the next slide. And so with such a large area that is broken down not only across multiple jurisdictions, divided by states, divided by county lines, which all changes all has an impact on what resources we have access to on and off the reservation. But we also are divided by chapter boundaries. So there's 110 chapters, and there's satellite communities like Alamo, Rema, and Tohajale. Our on-the-ground relief efforts, spearheaded by a GoFundMe that was started by Ethel Branch, a former Navajo Nation Attorney General, and all of the volunteers, which comprise of community organizers, community business owners, Dene advocates, environmental justice workers, healthcare workers, people who are from our detention centers, our CHRs. It's a wide breadth of just wonderful volunteers who stepped up to the plate to sort of build the infrastructure prior to the first case being confirmed in our nation. We're still having to deal with all of the geographical barriers to actually provide that service, as well as the barriers to actually access the supplies and groceries that are necessary to provide the type of relief that our families need. Chief Daniels was talking about how their tribal nations, the First Nations, are set up to manage poverty. It's much the same down here. Our tribal nations are structured around a welfare state, and we're constantly dependent on federal dollars to come down based on all of these parameters of what needy people or what vulnerable people they want to help, and who live in extreme poverty and face multiple extreme vulnerabilities. This is a completely different beast in terms of how we need to organize to provide the support and social networks that are necessary to keep our community safe, keep our families safe, and stem the curve of this virus. And so with our work, one of the major difficulties has been locking down areas that could serve as distribution sites, because all of the health and safety protocols that need to be followed in order to provide aid in a very safe and effective manner requires very strict conditions. And so our distribution sites need to be set up to be enclosed, to be clean and sterilized, to reduce the risk of exposure as people are creating food boxes and bringing bulk items in and breaking them down into smaller packages so that we could create food boxes that can support a household. And having the information to support those households are also critically important. So the fact that we turned around within a 2-week period of Ethel Branch starting a GoFundMe to creating the infrastructure to actually do this is really quite phenomenal, and really needs to show how much can be radically transformed when our people step to the plate using the expertise and using the resources and ingenuity available to us to actually fill in these gaps and provide the services that our communities need. And so each of the blue circles show where we kind of have some semi-permanent, well-functioning distribution centers. And for the area that I help organize on the New Mexico side of the state borders, this still creates enormous difficulties, because if you can see down low Rema, and you can see up north our in Hogback area our north distribution center, and you can see our far east distribution center, the only area where we have to date been able to get bulk deliveries of supplies delivered directly to is in Fort Defiance, which is right on the Arizona-New Mexico state line. So those areas, those 3 satellite areas, have to travel up to 3 hours with trailers and with their volunteers to come to Fort Defiance in order to get access to the bulk supplies and then take it back out to their communities. And we're always rushing against the curfew deadlines, because if we get caught, the tribal nation has not accepted our services, or deemed it, given us waivers to be considered essential workers, and they're the only government that does not recognize humanitarian aid relief groups as essential services, so that would allow us to work outside the curfew hours. So we're just as susceptible to the $1,000 fines for being caught outside those curfew hours. So we have to work to provide this service within those extreme limitations. You can go to the next slide. And so it's like this perception that this virus is spreading because people are just like out and about and rushing around, and that the volunteers are going to be just as radical as cruising the back roads in large groups in order to like go, I don't know, like not listen and go deliver aid. When the reality, you can go to the next slide, Nick. The reality is that we're following even higher standards than the CDC and the World Health Organization has put out there, meaning that even in aid, even in essential meetings, there's no more than 10 people at the same time, and everyone wears full PPE gear. And this is because we've recognized and responded to the extreme threat that this has to all of our community members, not just the elderly, not just the immunocompromised. All of our community members are extremely threatened by this because we can't afford to lose even one person. That impacts the entire family structure. It impacts, when it's an elder, it's a loss of a library, it's a loss of ancestral knowledge and lived experiences that are very valuable to our generations. And so when we're not only having to operate within all of the challenges of the geographical barriers, the lack of access to supplies, the lack of access to paved roads, which increases travel times, the curfew, but also having to work in really small groups, it's phenomenal to think that we've served to date 1,500 households, and that equates to like even more individuals when you take into account, like that's just the household, but some of our households have up to 10 and 15 people. And so you can go to the next slide. Like the process of doing that has been, we've just been trying to work with everyone that is willing to come to the table, because this is not the time to pursue community organizing as a lone wolf. This is not the time to perpetuate the grass, even what exists even in grassroots, in terms of grassroots politics, the competitive mindset around scarcity and around competition for resources. We all have to work together, because each of us creates a different piece of the puzzle that can help us work around these challenges. And when we started this relief effort, it was the transition of seasons. And so we're still dealing with rain, we're still dealing with snow, and that completely hindered a lot of our accessibility to many of our rural communities and rural households. But our community health representatives, our CXRs, really stepped up to the plate to be able to help deliver these items to homes. This is a picture of us delivering some of the aid that was provided by New Mexico Indian Affairs Department, as well as water donations that came in directly through the Navajo and Hopi's family COVID relief. And so bringing those resources together is what helps us bring and package enough resources and supplies to each household, despite other limitations. You can go to the next slide. And so this was being able to buy in bulk was wonderfully, and we're still working on streamlining all of this, but was wonderfully effective and helpful to minimizing the exposure of our volunteers, because prior to being able to buy things in bulk and setting up those supply lines directly with distributors, volunteers had to go out and fight with hoarders, with people in border towns who had the resources and the money to buy up shelves and shelves of food, and that increased our risk of exposure. And so going out, we had to practice even stricter safety protocols and learning from everything that we know about the virus, and which changes every time as more and more research updates what we know, to like cover our hair, to make sure we're not carrying it, to not touch anything. And it's always a risk going out. And I think this is also one of the challenges that prevents people from being able to step up to the plate, is that we need training, we need PPE gear to help support all of the volunteers that really want to help their communities. Go to the next slide. So getting the bulk distributions has radically changed the way and the speed that we're able to do this, but we're still limited by the map that I showed you with all of the different distribution sites. This is a distribution that happened yesterday. This is when I was on the ground with our team from Northern Agency. This was at the NHA Navajo Housing Authority compound in Fort Defiance. And so we had our Shamrock Food, $20,000 worth of food and supplies delivered to this compound. And then there we inventoried inventoried it and divvied it up to be disinfected by the different agency teams that took it to Northern Agency, Far Eastern Agency, and to REMA. And there they disinfect it at every step of the way. They repackage it into food boxes, disinfect it again, and they do no contact delivery to the vulnerable families within each of their service areas. And we still give people instructions on how to disinfect the packages when they bring it into their home. This is to eliminate any chances that this virus could be spread through relief efforts, but it's time intensive, it's labor intensive, and it requires, it slows down the way that we're able to turn things around. You know, in the next slide. And so on top of this, all of our volunteers, including myself, still carry on our day jobs. And part of my work with International Indian Treaty Council is working to address this across Indigenous peoples' communities across the globe. And what we're seeing is, much as what was presented from our northern relatives, is that governments are using this to exacerbate systemic inequalities, because those were structured that way to take away power, lands, territories, and resources from our people. So they see this more as an opportunity to continue that agenda, to continue fast tracking and streamlining their corporate capitalist colonialism in our communities. You know, Melanie, she mentioned what's happening with the Mashpee Wampanoag, so I don't need to go into that, but with the KXL and with anti-protest laws in the United States being fast-tracked during this period, where it's creating more barriers for people to mobilize, because they're going to use the CDC guidance against us if we dare mobilize in groups greater than 10, but also expanding the definition of critical infrastructure to protect oil and other extractive industries infrastructure. You know, these are things that are worked on by entities like International IEN, IITC, and the Indian Collective. But also on the borders, we're seeing increased militarization in our border areas to build Trump's border walls, and all of these corporate employees, from everyone who's occupying man camps, who building these pipelines, who building the border walls, are militarizing and patrolling and increasing military surveillance of tribal lands. These are all considered essential employees. So they're all given that waiver to go and move throughout our communities and our traditional territories without being held accountable to the guidance of social distancing and self-isolation. And this increases the probability of exposure from those very entities in our tribal communities. And so on top of this, you know, and with the Trump administration, we're seeing this relaxation of emission standards, and we're seeing more and more corporate bailouts being carried out at this time to protect the oil industry. And so we can't even rest in this period to focus on bringing relief efforts to our communities, because we still have to hold the realities that these ongoing colonial projects are continuing to be carried out. These violations against our human rights are accelerating in many places across the globe. And so we call, as IITC, we're calling for rights-based approaches to not only COVID responses, but also in post-COVID recovery efforts. And so we're hosting a series of webinars that will be taking place every Friday. This morning was our first one, to help people get access to these tools and the training necessary to understand how to document and then how to file these complaints. Because at the end of the day, one of the ways that we can build better alliances is by documenting from our own perspectives what these human rights abuses are, and sharing that with one another so that we can better strategize, because we all are exposed to some aspect of the chain and of power and control that our government have been exerting on our communities. You can go to our next slide. And so like right now in this period, it's not just about understanding, you know, like our vulnerabilities and how to address that, but recognizing that our peoples have been talking about these prophecies that have been coming to fruition for quite some time, even prior to COVID. You know, like we've been seeing these signs and all of these tellings of what is of our world being radically impacted and radically out of balance prior to COVID. And now that COVID is is here. We need to recognize that it's not showing us what needs to be fixed in the system, but it's showing that this system fundamentally does not work, and that it was never meant to work for us in our communities. And that what we are doing right now, and seeing how like everything about the mainstream society is being radically transformed, shows that it was always possible to promote radical transformation in our economies, in our consumption of unsustainable energy sources, in our unsustainable practices. And that right now it's not about access to food systems, but about creating our own food systems, creating our own food sovereignty, protecting our water sovereignty, and creating the social and cultural nets that our communities have always needed and have always deserved before prior to COVID reaching our territories. And that now it makes it much more essential to invest in those dreams. And so we're living in a time where being safe, being smart, and taking care of ourselves is a radical way to keep our communities safe. But building off of that foundation, investing in our communities and building the social nets that we need is the way that we're going to transform our world and continue this movement towards the change that we needed prior to all of this, that really is going to build the alternatives to the corporate colonization and the way that it has exerted power across all of our territories, and to provide something better that works not only for Indigenous peoples, but also for our non-Indigenous relatives who are also made vulnerable by the class, racial, and economic divide that plagues our communities.
Well, I feel like if we were in a live room situation right now, people would be standing up and applauding. And I'm not just blowing smoke. I think that while the three of you have provided such an incredible picture of the challenges that Native people are facing, just going to use some sound bites from each of the three of you. Chief Daniel said that Native nations, First Nations, have been reduced to managing poverty because of colonialism and the way that the state treats and violates Indigenous sovereignty. Destiny, you used the term squat to survive, which is actually a campaign that you participate in. But in fact, Indigenous people are forced to squat to survive in large numbers. Again, I said the majority of unsheltered people in Albuquerque are Indigenous and Navajo people. And so they squat to survive, even on our own homelands, right? And that this is the condition that colonialism has placed us in prior to the pandemic. And finally, Janene, you use a term that I've actually never heard about before related to food sovereignty, food apartheid. And then one of our participants actually said medical apartheid. And I think that the term apartheid is so appropriate because it speaks not just to inequality, but it speaks to the persistent colonial condition that has framed and really exacerbated what Native people are facing right now, not even to mention the hostility, at least those of us who are sometimes unwilling citizens of the United States from the Trump administration, to actively trying to terminate tribes, trying to steal money, and trying to use the situation to exert even more violence upon Native people and tribal nations. So thank you so much again, Tsago, for the powerful words that you've spoken tonight. So we've had quite a few questions. We have some questions that are very specific to each of you, but I wanted to actually start out with some more general questions that the three of you might be able to address. Back when Chief Daniels was talking, we had a couple of questions about kind of coalition and support. So I just wanted to start out by asking you all, how can we, meaning anybody who's on this webinar, anybody Native or non-Native, support First Nations and Native communities during the COVID-19 pandemic? And feel free to answer in any order, and don't answer if you don't want to.
Well, thanks for the question. I think that a lot of us are doing that work, reaching out as much as we can, and at the same time doing our work in our communities, our local communities. I think these kinds of discussions, more network work, collaborative work. When we did last summer, we hosted an Anishinaabe gathering, and basically what that was is we were reaching out, and that's why actually I went to Michigan at the time, because I wanted the descendants of Pontiac to come and reconnect with the Anishinaabe people, because we were the ones who really did that fight for the during Pontiac's war, and kind of wanted to reattach our kinship and our bringing together the larger family. And connecting and in person and holding our ceremonies and talking about our creation stories and talking about Nana Bouger, those kinds of things as a just kind of bringing back our family tree. And so that's a part of it. I think the larger nations throughout Turtle Island, the more we do that I think that's important, and we focus on the wins that we have, the progress that we have. Those kinds of things are also as important. If we're seeing good work happening, we have to do that. We have to work together outside of the colonial system that has actually excluded us a lot as well. We talk about how it's been imposed upon us, but actually we've really been excluded from the financial sector for like decades and decades. That's why we're not owners to a great deal, or we haven't been over the course of the last 100 years. We've actually been excluded. My grandfather was a great farmer, and he was excluded from the agricultural sector. But when they imposed the pricing, like certain pricing, so he couldn't be competitive. So it's those kinds of things that have brought us to where we are. If we're going to get out of it, we have to bring our efforts closer. Our systems of transportation, our systems of knowledge, planning. A great deal of conversations are happening around community sustainable gardens, those kinds of things. So I think we just continue to do that. We do it as much as we can as individuals, and hopefully communities continue to do that as much as they can. But I think that we have to have year-round gardens. We have to think about community sustainability, micro-grids, micro-community planning, micro long-term, comprehensive community planning. Those kinds of things I think are important. And then as much as we can, think about how we can support one another. And so that's ongoing work that's happening right now. We just need to continue to pressure it. And again, education is that's where we have to focus, and not only educating ourselves, but educating those who are, especially the young people, non-Indigenous young people, very open to new ideas. I think the older ones, I think it's much more difficult, but I don't think that we give up. We just continue to do it.
Sorry. Thank you so much sorry, there was a Zoom pop-up window that confused me. This is my second time doing Zoom webinar. It's a little confusing. Thank you so much for that response, Chief Daniels. I think it's incredibly helpful and encouraging to hear about the different ways that folks can support. So I'm gonna direct a couple of direct questions at folks. So Destiny, there was a question that came while you were speaking with a question about rent freezes as a tactic. And has Red Braid been organizing for a rent freeze in your work?
We are doing some rent freeze or rent strike stuff, but it's less developed. Our stronger need is for squat to survive, because a lot of people seem like they are not in as harsher need for a rent strike at the moment in the neighborhoods we have spoken with. So since Canada is treating Indigenous and poor people as a threat to public health, we have been trying to show that the government is not supporting the poor, and that homeless people are being pushed into camps and prisons where they are in danger. We have worked with humans and legal rights groups like Pivot, and with public health advocates like Bernie Pauley, to make public health arguments to house the homeless people. But it's hard because Indigenous people are being treated as part of the public, getting help in the public health crisis. What Mama Bear has said, the person who lives in Maple Ridge, that communities, we need our kinship to survive, that we are safer together, that when they're when they talk about their kin, they're not just talking about their blood family, that she refers to people who she survived with on the street as her street family, and that when they come to her door that they have a couch and a floor to sleep on, that they are under a roof and that they are safe. She has stated that with COVID-19 affecting policies, it has built policies where she is not allowed to have visitors in her own home, that she is supposed to keep the door closed and not open it to these people who need to be indoors and safe from hazards like the of possibly dying of exposure. It did some snow last month, and actually April 1st, that night it snowed, the day that the hothouse squat started. That people on the street are at risk of police brutality, that they are being pushed around and told to leave, but homeless people do not have anywhere to go to, and the greatest people at risk are Indigenous homeless people. And this is why Squat to Survive needs to happen, so we can carve out space in these squats for Indigenous people to be safe. There is a rent freeze, and trying to support individuals and trying to develop collective resistance. September will be tougher for people in neighborhoods, and with Curb only being a few months, it's not going to last long, where people could seem more comfortable financially for this month or next month, but who's to say what's going to happen in September or the following months to come and the following years to come? How long are we going to be able to pay our rent, and how long are we going to be able to afford to feed ourselves or to be able to get through this pandemic? Yeah.
Thank you so much for giving us a clearer picture about that. So Janene, there were several questions for you. They're very specific. I'm just gonna ask you one because we're at an hour and a half, which is amazing. But I don't want to take up everyone's nights. I know it's later for the folks in Central and Eastern time who are participating in this. So the question, you had spoken about the essential employee designation and the conflicts around that, creating difficulties for the work that the Relief Fund is doing. Is the essential employee designation not under the control of the tribal government? I think you were saying it is, but could you just clarify that?
Yes, it is. And that's why I made the point that our tribal government is one of the only forms of government that I know of that does not recognize humanitarian aid as an essential service. And we've made requests to the administration to grant our volunteers a waiver so that we could work outside the parameters of the curfew. And both times the requests were denied. And the reason given the first time was that a waiver was given by someone in the administration to a church to allow a church service, a drive-up church service occur around Easter weekend. And the public backlash has justified apparently eliminating any waivers for any other essential service designations. But what we're seeing is that one, like the 57-hour curfew definitely takes away very vital days for us to provide relief and service. But it seems contradictory because out of that 57-hour curfew, people are allowed to leave their homes if they're going to get groceries. But what we're trying to say is like, why are we even putting them in that situation when we could actually be delivering aid and relief directly to them, preventing them from having to go out and possibly get exposed. But also we're seeing that there's across the globe where they're dealing with the type of rise and epidemic that we're seeing in terms of the rates of contraction of the virus. It's more than a 57-hour curfew. It's a 24-hour, 7-day-a-week lockdown until we can get our hands around controlling the spread of this virus. And during that time, that's why essential workers are so important to helping to stem the curve, because their services are vitally necessary in order to support that type of lockdown and that type of security. And so we're going to keep asking, we're going to keep working in good faith with the tribal government. But aside from that, we are very much partnered with different employees of the nation that do qualify as essential workers. And so they're helping us as well to get aid out where it's needed. But like I showed with the map, like we need critical mass. We need to do this safely and securely, obviously, and follow all of the strict health and safety protocols. But we do need more liberty to be able to do this across the nation and provide the services needed to especially our most remote and rural areas.
Absolutely. Thank you for clarifying that. So I'm going to leave it there. I'm just going to invite any of you all to give any closing comments. I just wanted to thank you for all of the beautiful and fierce solidarity and internationalism and kinship that you are all showing your people, your relatives, non-native relatives who are in these struggles with us together. Humanity, it's a global pandemic. I think you've really shown us the spectrum of what that looks like, whether it's an Indian country, which usually refers to kind of Native nations and Native spaces in the so-called United States, or with our First Nations relatives in Canada. So thank you so much for that and for sharing that with us. And if you want to make any closing comments, and then we'll wrap it up. One more time, just want to remind people we're going to have another Friday forum. Friday, I think I'm missing a word in there. Friday forum, it's late. Next Friday at 6 p.m. and we'll continue to have them through the end of May. But any final comments from any of you?
I just want to say that we've been here before and we've come out and we've survived, but now it's about more than surviving. It's about building the structures, the unity, the collaboration necessary to thrive and to take back control over our future. And we're very much capable of doing that. We have the expertise, we have the access to resources, we've saved enough of our land bases to control and take back control over our lands, territories, and resources. It's just about using this time to act and to build that solidarity necessary to really rebuild our power, take back our power.
Okay, I think with those powerful words from Janene, we're going to wrap up. Janene did share links to the International Indian Treaty Council, as well as the Navajo Hopi COVID-19 Relief Fund in the chats, but we will also be sending out an email with links to the various organizations that our speakers work with and on behalf of, so that you can possibly make donations and learn more about the work that they do. All of you for joining us tonight. Have a good evening.